Doctors use this series of tests to diagnose if you have carpal tunnel syndrome, tendonitis, or another problem with your hand. Of course, these are not definitive tests, and you should consult your doctor for a thorough diagnosis. We will demonstrate the self-tests on one hand only. Repeat them on your other hand if necessary. To perform these tests, it's important to sit in a quiet room with no distractions. The following 3 tests are used to determine if you have carpal tunnel syndrome. If you answer yes to any one of the following 3 tests, then you probably have carpal tunnel syndrome. Test 1. This is called the Quervain test for carpal tunnel syndrome. Hold your hand upright. With your fingers straight, flex your wrist gently and as far as possible. In other words, bring your fingers as close to your wrist as you can. Then hold this position for 1 minute. Do your symptoms appear or get worse? Do you feel numbness in your hand or fingers? If you answer yes, then you probably have carpal tunnel syndrome. If no, continue to the next test. Test 2. This is called the Tunnel test. Hold your hand upright. With your hand straight, lightly tap the skin over your wrist crease. Tap left to right and back and forth a few times. Does it result in a tingling or pins and needles feeling in your hand or fingers? If you answer yes, then you probably have carpal tunnel syndrome. If no, continue to the next test. Test 3. This is called the Dupuytren test. Hold your hand upright. With your hand straight, use your opposite thumb to apply firm pressure to the entire width of your wrist crease for 30 seconds. Put your hand down and relax for 1 minute. Then apply firm pressure on your lower palm for 30 seconds. Does any of this pressure make your symptoms appear or get worse? Do you feel numbness in your hand or fingers? If you answer yes, then you probably have carpal tunnel syndrome. If your answers were no in all 3 tests, then continue to the next test. The following test is used to determine if you have tendonitis instead of carpal tunnel syndrome. This is called the flexor percussion test. Hold your hand horizontally. Use 2 fingers to tap your flexor tendons just below your wrist crease. These are the rope-like structures on the palm side of your forearm. Tap each tendon all along its length, halfway to your elbow. Tap several times up and down on each tendon. Then tap vigorously all around your forearm. Does any of the tapping reproduce your symptoms or make them worse? If you answer yes, then you probably have tendonitis and not carpal tunnel syndrome. If no, you might have another condition. Continue to the next test. The following test is used to determine if you have Quervain's tendonitis. This is called the Finkelstein test. Bend your thumb down and across the palm of your hand. Then cover your thumb with your fingers. In other words, make a fist with your thumb inside. Next, bend your wrist toward your little finger. Does this cause pain? If you answer yes, then you probably have Quervain's tendonitis. If you answered no, you might have another condition. Continue to the last test. The following test is used to determine if you have Dupuytren's contracture. Take a good look at your palm. Is there puckering on your skin? Press on different areas of your hands and fingers to feel for tough knots or rubber bands under your skin. Then, see if you can press your palm flat on a tabletop. If you cannot fully flatten your fingers and palm, or if you feel these knots and see skin puckering, you probably have Dupuytren's contracture. This concludes the tests. Remember, see your doctor for a complete diagnosis of your condition. Learn how to treat carpal tunnel syndrome and other hand pain conditions at carpalrx.com.